Dr. Purvi Parikh, welcome to ITV Go. Thank you so much for giving us your time today.
Yes, thank you for having me.
I have a lot of questions for you. So my first question deals with one of the biggest news coming in today. Pfizer has now given its data on ages 5 to 11 on COVID-19 vaccines and is going to the FDA right now. So my first question to you has to be about the fact that we'd like some insight into what's happening with these data trials. And also, I'd like to know how they came up with the dosage for the children.
Right. So usually in all the trials, even in the adults, we look for the lowest dose that can still be effective and safe. And by doing that, it's helpful. So that way there's less side effects and you can provide more doses for people, right? So what they found in children was a third of the dose was just as effective as the normal size dose for adults, and it was very safe too. So this is great news. Children's immune systems are still developing, and they're smaller, obviously, than adults, so the dosing is understandably different.
We'd like to know if you see any developmental impact of the COVID-19 vaccine on this age group specifically. I think that's what the parents are most worried about, the growth of their children and COVID-19 vaccine, affecting that.
Right. Yeah, so there's no real medical or scientific way that the vaccine can affect growth, and the reason being, or development, and the reason being that the half-life means half of the vaccine is out of your body within 1 week. So within 2 weeks, the vaccine is actually gone. It's excreted from your body. But what remains is the benefits, meaning your own immune system is then now immune and ready to fight the virus. But if you get sick with COVID-19, then your child will have many problems. They may get admitted to the hospital. We're seeing even pediatric deaths, and there might be developmental and growth problems, even in pediatric survivors of COVID-19. We don't know the impact of the virus long term. So the vaccine is actually the best bet. You're protecting your child the most by preventing them from getting sick in the first place.
Right. So the FDA, it's going to discuss the data that's been submitted. What do you think they're going to look at in that data? And we're hearing that maybe towards the end of October, this vaccine could be available. What do you have to say about that timeline?
Yeah, that's great news if that occurs, because we need to get our children vaccinated as soon as possible. They're returning to school. This is already a big season for viruses, even before the pandemic. So hopefully, I think the FDA is going to be looking at, first and foremost, make sure it's safe, make sure it's effective at preventing COVID-19 and preventing especially severe COVID-19 and hospitalization from COVID-19. And I think if all of those things are true, they probably will approve it. And I think the sooner is better, because, our children have suffered a lot in this country. They've been kept home from school, and actually that's affected their development and growth significantly, because kids can't learn as well over Zoom or remotely as they can in person.
Yes, for sure. This brings me to the million-dollar question right now. Debates are still going on for some reason across the country on mask mandates in school, as well as vaccine mandates for school staff and teachers. I'd like to know your personal medical opinion on mask mandates in school and its importance. And also, while you're responding to that, how do you feel about certain states that are banning these mask mandates in the schools?
Right. So masks, we already know, I don't know why it's being debated, but they work, and just even from a common sense standpoint, if everybody has something covering their nose and mouth, it's much less likely for viruses or any other germs to spread person to person. The mask mandates in schools are very dangerous, especially for young children, because, they're very important for young children, but banning them would be very, very dangerous, because if children aren't protected, especially before they have a vaccine, they can easily spread it. Schools will have to be shut down, and then the children have to return back to remote learning. And remember, before we thought that children were unaffected by COVID-19, but that's not true. We are now seeing a huge increase in pediatric infections, and 1 in 5 cases currently are pediatrics, and it's not always mild. We're seeing kids pass away. We're seeing kids in the ICU. And think about it, even one child who gets affected and severely ill is too many.
Right. What is the biggest cause of this rise in cases, according to you, in children, doctor?
I think it's the new variants because the new variants are much more contagious than the original strains of the virus. And so that's what we're seeing as they mutate. They are infecting children more so because they spread so quickly. Like for Delta to spread, you only have to be close to someone for 5 minutes, whereas originally it was 15 minutes. So as you can tell, it takes very little, especially if you aren't vaccinated and protected, which all kids under age 12 currently are not. The other concern too is that children can infect others, right? So even if they get mild forms, they can bring it home to grandma or grandpa, make them very ill, or if their parents or teachers have serious medical conditions, that's other things to consider too.
Right. Are you concerned about parents that themselves have not gotten the vaccine and probably will not get their children vaccinated? How will that affect the country, doctor?
Yeah, absolutely. You know, the vaccines are our way to kind of move out of this pandemic. And much of what we're seeing is due to people not being vaccinated. So 99% of deaths are all unvaccinated individuals. Over 90% of hospitalizations are all unvaccinated individuals. So if parents don't get vaccinated and they don't vaccinate their children, it's only going to cause more problems and delay us getting out of this pandemic. The other problem too is these new variants that are emerging. They are coming out of unvaccinated individuals because they're the ones who are passing around the virus. So if that continues, my fear is there might be a variant where the vaccines are not working as well. And all the progress we made, I would hate to see go backwards.
What kind of news are you getting from across the country in overly capacity hospitals with exhausted staff? What are you hearing in the medical community?
I mean, it's very bad. Healthcare workers are at the point of complete exhaustion and burnout. Many are having to leave the jobs because they can't handle it. We're hearing increase of even suicides already. Healthcare workers were very burnt out even before the pandemic, and this is really straining because there's been no break. You know, some of these frontliners have been working nonstop for almost 19 months now, and it's very stressful and tiring to care for COVID patients because they're much sicker than average patients, and they demand much more. So I really worry that we're going to burn out our healthcare force, and then who's going to take care of everyone?
Exactly, and not to forget they're constantly exposed to the disease.
Yeah.
Even when they're wearing their PPE, they
Right.
can. We've heard stories of doctors dying because of COVID-19. Let's now talk about the booster dose, doctor. There's so many questions about it. About 400,000 Americans have already received their third dose. President Biden also got his first dose, his third dose. How are you looking at the booster dose and its importance? And many are saying across the world that perhaps these vaccines should be sent over to other parts of the world where they don't have enough vaccines. Do you think the U.S. is doing it too soon?
Yeah, I mean, those are great questions. So what we know is, a lot of the data coming out of Israel, right, about the need for booster doses. For them, it was very necessary to start giving them to most of their population because, again, their healthcare system was getting overwhelmed. Even their healthcare force was getting sick again. So even fully vaccinated individuals. So I think for certain folks, the booster is crucial. I don't necessarily think every single person may need a booster, but we have evidence that immunity does start to wane. And I think after this booster dose, we won't need as many because the longer the gap between the vaccine doses, the more robust the immune response. So the reason why we had to do the first two doses so close was because we're in a pandemic. So we were in a rush to get everyone protected. But I think after this dose, hopefully there may not be a need for as many. And I completely agree. I mean, people need to get their first shot before Americans are getting their third. So that I think we need to do more in getting vaccines out to areas of the world that don't have access because an outbreak anywhere is an outbreak everywhere. So we're actually protecting ourselves by helping other countries get vaccine supply. I think more can be done and we should be doing more. So yes, for certain individuals, boosters are important. If you're immunocompromised, if you're high risk, being continuously exposed, certain age groups, absolutely. But I don't think necessarily everyone needs to run out and get a booster because still the vaccines are protecting well against death, against hospitalizations, and 100% we should be sharing it globally because, again, by just vaccinating a few countries, we also are not going to move out of this pandemic.
Yeah, a very complicated process of, where the vaccine should go and what should be done. With this booster dose, as you mentioned, it's right now eligible to certain kinds of people. And it's also eligible to 65 and older. So I'm seeing the same pattern as we saw earlier this year when the vaccine doses had just started. We saw people at the most vulnerable aspect of their life, getting the vaccine first, and then slowly down it circled down. Is it the same thing happening here? When should the normal public who are not in these categories be vaccinated?
That's a good question. So if you're not someone who falls in these groups, again, you don't have to panic. There's not a rush for the booster dose because the current vaccines are still very protective. But there may be a time down the line when that formal advisory will come out that now general population should get vaccinated. So we're tracking everything. So if it comes to the point where we're seeing that there's an increase in young healthy people who are vaccinated being admitted or getting very sick, then I think that recommendation will shift. But so far, young, healthy people who don't have a high-risk occupation so far are doing pretty well. They're not getting admitted. They're not passing away, thankfully. If they do get sick, it's very mild. So that it all depends on that. If that shift occurs, then we may have to do what Israel did and then move the age group down to younger and healthy individuals too.
And this 6 months mark, if this, the regular public that are not in the category, if they pass their 6 months mark, you don't think they have to really worry right now?
No, because actually the data shows eight months after is when you can even start to see a decline. But even then, remember, that's only looking at antibodies. And people forget or may not know that antibodies are just one small part of the immune system. The vaccines make the rest of your immune system protected too. So all of us have T cells, and those T cells are programmed to really hold on to immunity for a very long time. And so even if your antibodies start to fall, your T cells will kick in and hopefully make more antibodies if your immune system is working well. So you have a lot of backup reserves, is my point. Not to sound too technical, that not to panic, because again, it's 8 months where that decline starts, but there's so many other parts of your immune system that are also immunized against it. So you still will have a great chance of fighting off the severe illness and death. And as you know, we're learning as we're going. So we'll probably have more concrete information on that soon.
Yes, let's now talk about, I just have 2 more questions left for you, Doctor. Long haulers. It's the number of long haulers in the country is increasing. It's concerning experts all over. I know certain hospitals already have a certain thing called COVID Trauma Recovery Center in which they are dealing with these patients who are long haulers. Now, what have you seen in all of it? And are South Asians at high risk of being long haulers because they were at high risk when we didn't have vaccinations? So how are you looking at both those things?
Yes, absolutely. So the COVID long haul is very important to talk about because 75% of people who've recovered from COVID-19 have some symptom over a year later. And it's not mild. Like I'm seeing people who can't work, can't go to school because they have severe brain fog, trouble concentrating, shortness of breath. Every organ system is affected. They can't eat, they're losing weight. So absolutely, and everybody's at risk. So this is the biggest case I can also make for vaccines outside of death and hospitalization. Trust me, you do not want long haul COVID. It is not easy recovery. These are all young, healthy people, vibrant people who are now completely debilitated. So yes, everybody is at high risk, and especially, as you said, South Asian groups, other minorities who disproportionately are higher risk for COVID in general. So that in itself is enough for me to get the vaccine, let alone the more severe issues with the virus.
Yes, definitely. And my last question to you, Doctor, has to be, it's a 2-part question. I'd like to know your take on the importance of getting the flu shot this season, because it is that season, it is available if I'm right, and it's something that, I feel like not enough people are talking about. And also, what's your prediction for the next month?
Yeah, so flu vaccine is extremely important. Please get it. As these hospital systems are getting overwhelmed in COVID in some parts of the country, you do not want to get flu, because if you get sick, there's no space in some of these hospitals. Also, if you have any chronic conditions, you are at risk of very severe cases of flu. And remember, speaking of kids, flu, even before the pandemic, killed children. We see many pediatric deaths from flu. So it's in your best interest to get everyone protected in your family. Hopefully it'll be like last year, where we saw an increase in people getting flu shots. We also saw a decrease in flu because everyone was masking, washing their hands, distancing. So I hope people keep that up so that we have some relief on our overburdened and overexhausted healthcare workers.
Yes, and what about a prediction, doctor, for the next month or so? What are you thinking is going to happen?
Yeah, so the CDC is predicting hopefully we'll get a little relief, and we're already starting to see that, like a plateauing of cases, similarly to what happened in India, where there was a explosion of the Delta cases and then they kind of leveled off. So I'm hoping that continues, and hopefully with increased vaccinations, as people continue to get their initial doses and boosters, that will also continue. In addition to, hopefully people are now more aware and protecting themselves against other viruses as well. But, winter is always a high risk season for any cold, flu, bacteria. So we have to still, stay vigilant. Yeah. But I'm optimistic. I'm hoping that things will improve.
Yes, I'm hoping so too. Hopefully next time we have you, we have more positive news to share. Thank you so much for your time today on ITV Gold.
No problem. Thank you for having me.